Good day, everyone. Today I will discuss the seven steps of moral reasoning model. So, the number one is gather the facts. The patient was wounded in gang violence. He probably fears rejection and perhaps retributions from his fellow gang members, especially if they discover that he is an HIV positive. The patient's sister would be changing fairly sizable wound dressing for her brother, and the chances are high that she would come into contact with his HIV infected blood. So, as we have noticed that the patient is not ready to expose about her sexual preference to his family members and friends. That is why he keep it secret because he might be afraid of losing his family and his friends and or being judged. And according to information, there might be a high risks and endangered the health for her sister because of blood acquiring virus. So it is very dangerous for her. For the number two is determine the ethical issues. The conflict is the need for patient confidentiality versus the duty to warn the sister of risk of harm. So the doctor faced this challenging scenario because he will choose only one or only one uh, answer. If he stick to obey the patient request or break it by warning his sister about the truth. For the number three is identify the principles that have a bearing on the case. Principles number one, patients have a right to have their medical information keep confidential. Then number two is the duty of the physician to warn interested parties other than the patient if they are at risk of looming harm. So the crucial question is the degree of risk that the patient's sister is taking by providing nursing care for her brother substantial or not. Some may claim the risk to the patient is not as severe as the risk to the sister. Worst case scenario, his father would disown him and the gang would throw him out. So, being a knowledgeable professional doctor, they don't have to be rush to make a decision. That is why they have to analyze the situations first and consider both parties and take full responsibility. But on the patient's side, he or she might be affected according to what they did before. So, in short, they write what they saw. The number four is list the alternatives. Number one, tell the sister that her brother is an HIV positive. Then the number two, refuse to tell her that information. Or maybe you would consider other alternatives like Number one, warn the patient's sister in general terms about taking suitable precautions for caring for this type of wounds, like wearing gloves and a mask and washing instantly with a disinfectant soap. So the number two, you have to request the patient to inform his sister about his condition and request that she will not tell any other family members or any of his friends. So now the doctors have the recommendations and agreement between the patient. So they need to decide it urgently before it will worsen the situations. On my side, I need to tell the patient to inform her sister or the family member at least one about his condition and keep it secret while explaining the full details of the said virus. That's it. Then the number five, compare alternatives with principles. For Ray, encouraging universal precautions for the sister but not telling her why comes close to satisfying all the pertinent principles. So, as the doctor said, he is just doing his job, not to say directly to the patient or the patient's sister, but reminding her that this illness or this disease is a serious and is also deadly, so it will need our attentions and awareness. For the number six is assess the consequences. Telling the sister or insisting that the patient tell his sister has these likely consequences. So the number one consequences is the sister would be saved from the risk of developing a fatal illness. The number two, the brother's HIV status would be out in the open to family and etc. Then the number three, trust with the patient physicians suffers. The patient may refuse to see doctors, which is unfortunate since he will need ongoing medical care. Then the physician refusing to disclose the information may have these consequences also. Like the sister would be vulnerable to contracting an infection for which there is no cure. Then the number two, the patient's HIV status is a well kept secret as his homosexuality, but it is not likely that either his HIV status or his homosexuality can be kept a secret forever. So another one or that number three, trust between the physician and patient is maintained. Another consequences is telling the sister to take general precaution is adapted may have these consequences. Number one, she may exercise caution in taking care of her brother, but she may not. Then the number two, the patient HIV status and homosexual orientation are kept secret, but they will become known but eventually. So the number three, trust with the physician and patient is maintained. However, if the sister asks her brother questions about the precautions, he may think that the doctor has prompted her to ask this question, then leaving him feeling betrayed. So, as you can see, there is a lot of consequences the doctors will be facing about this issue of HIV. That is why this topic will have a serious study, and communication is the best or most important communication with the patient, and this may assure that the doctor's patient will feel comfortable, and maybe on the other or the same or the other day he will do his or her job, or he will cooperate with the doctor because uh, they have built the trust and the good treatment and also the hard work for our doctors. And the last one is make a decision. Number 7, we need to have we need to have a guiding questions like which principles are most witty? Are there others that you would include? Which alternatives are the most viable? Are there others that you would suggest? Which consequences seems to you the most severe? Are there others that you think will occur? So, for me, we need to be genuine and give our empathy to the people who needs our help, because at the end of the day we will find happiness through our decision makings, and always remember that we need to have a remarkable decisions that will last for a lifetime. That's all. Thank you.